All right, welcome back, everybody. Tracking medical news this morning on Rising. Falling continues to be one of the leading causes of injury and death here in Lee County for specific age groups. Well, this morning I'm joined by Mark Tesoro. He's an injury prevention educator over with Lee Memorial Health System to talk about ways to protect yourself. And just in time, yesterday was the first full day of fall.
Absolutely.
So your play on words, we do appreciate that, of course, here on Rising. But let's talk about falls, of course. Who are we talking about in this age group? Are we talking about seniors?
Well, yeah, the older population, when we see people coming into the trauma center for injuries and those kind of things, age 45 really, not really seniors, from 45 and above, it's our leading cause of trauma, injury, and death.
Well, that's good to clarify because we often think of the elderly, and they fall, like we were saying.
Well, the elderly is getting younger and younger, so.
That age is changing. I feel like the elderly a lot of time, but but we were talking in the break a little bit about just because you're older, that doesn't mean that you're going to fall. There's other factors making you fall.
Absolutely. You know, falls, what we want to make sure people are aware of, falls are not a normal part of aging. A lot of people think that when they turn 60, 70, 80, people tell them, or they, in their own head, they're saying, well, you know, this is part of growing older. And that's simply not the case. If you're falling, these falls are preventable. And we need to figure out why you're falling and prevent that first fall from kind of spiraling into causing more falls.
What are some of the things that you see why people are falling that is something they could prevent or work on?
Well, one of the reasons why it's such a challenge is that there's so many factors involved with falls. Most people immediately think of strength and balance, but then certainly there's vision issues, there's of course balance issues, but then there's also footwear issues, lighting, you know, simply rushing. So there's a ton of different kind of factors that are involved with falls. Clutter in the house. If something happens, if something's going to happen, it most likely will be in the home. So you have to make sure the home is taken care of and make sure there's free of clutter and those kinds of things.
And those are things you can have some control over.
Absolutely.
For sure,
you know what? All of these are preventable. It's a question of just, and I really don't care how frail you are, as long as you identify why things are happening, to get assisted devices in place like a cane or a walker or something along those lines, because you really want to prevent that first fall from causing other instances.
Yeah, absolutely. All right, so tell us about this seminar that you're having to bring some
Well, it's an event coming up. We're really excited about this, and I really hope the public takes advantage of it. We're having a number of different screenings this Monday at Gulf Coast Village, which is on Santa Barbara Boulevard, 133 Santa Barbara Boulevard. Between 10 and 1 p.m., we're going to have a number of different professionals screening hearing, vision, balance assessments, blood pressures, flu shots. We'll have vendors there that have grip bars, footwear, you know, and then we'll have demonstrations throughout the entire event on Tai Chi and yoga and those kinds of things. So it's just a great positive way to reduce the stigma of having falls or fear of falls, and just have everybody come out and take advantage of this free opportunity. I hope they come out.
Yeah, absolutely. That sounds great. Lots of different opportunities there. And again, that's on Monday from 10 to 1 at Gulf Coast Village, right? On Santa Barbara and Cape Coral, as you mentioned. So if you have some trouble finding the place there, we'll have it posted to our website. And as he said, it's free. So you could really do something there.
It's kind of an all-in-one inclusive opportunity to see all these people all at the same time.
Yeah, absolutely. Sounds good. We never want to admit that we're getting older, so we don't have to feel that
It's hard, you know, and there's, like I said, there's a stigma attached to it, but there shouldn't be. There shouldn't be. You know, we want to keep everybody healthy and age in a healthy manner.
I like that. You're doing a good job at it, Mark.
Trying our best.
Thank you so much.
Thank you.
Appreciate you coming in today and telling us about it. Like we said, we'll post that info again onto our website a little bit later this morning at fox4now.com.